So guys, we'll be looking at the possible tests in the laboratory that we can actually do to actually access the levels of potassium in the body, okay? And a collection of these tests is what we call assessment, okay? Ways to access for urinary potassium levels in the body, okay? So assessment of urinary potassium in the body. And potassium is an important electrolyte in the body, okay, but there's a normal range for potassium levels in the body, and potassium at any times it should be kept within this range. Do you understand? It should be kept within this range, because once it exceeds that range or it goes below that range, there will be a problem. So guys, assessment of urinary potassium is crucial in evaluating electrolyte balance and kidney function. Now here are some key aspects of accessing urinary potassium, or basically here are some key points that you should note when you are trying to actually access for the levels of potassium in the body. You should know the urinary potassium level, the normal one. The normal range is what? 25 to 125 MEq per liter, that's milli equivalent per liter. Okay, the normal potassium levels in the body is 25 to 125 milli equivalent per liter. Then you could do a 24-hour urine test, okay? That's where you collect the urine of the person over a span of 24 hours. And basically, it measures the potassium excretion over 24 hours. Now, it helps to diagnose conditions like what? Hypokalemia, which is low potassium, or hyperkalemia, which is high potassium, okay? Because you basically need to monitor the person over a long duration, which could be 24 hours, okay? Then the spot urine test, it is a single urine sample. Sorry, a single urine sample can estimate potassium levels, but may not be as accurate as a 24-hour test, right? So spot urine test is basically the very urine at that time. You don't collect urine over time. You just collect a single urine, okay, and test for potassium levels. So basically, the one that you are collecting over 24 hours should work better than the spot one. Do you understand? Then you could have urinary potassium to creatinine ratio, and this helps to adjust for variations in urine concentration. Then clinical correlation, that's clinical correlation will interpret urinary potassium levels in conjunction with what? Serum potassium levels, right? You look for the medical history of the patient, then look for physical examination findings. Then electrolyte imbalance rather. We say that abnormal urinary potassium levels may indicate electrolyte imbalance, may also indicate what? Kidney dysfunction, and may also indicate what? Hormonal dysfunction too, okay? So these are all the things that you are looking out for when trying to what? Access for urinary potassium levels. Medications and foods. Certain medications like diuretics and foods like bananas and leafy green leaves can actually affect urinary potassium levels, okay? Basically, they should elevate it. Then kidney function test, we say that urinary potassium assessment helps to what? Evaluate kidney function, and also helps to what? Dictate potential issues like what? Kidney disease or damages, right? So please, you should consult a healthcare professional for proper evaluation and interpretation of what? Urinary potassium levels, right? But basically, these are the different ways that we can access for what? Potassium levels in the body, okay? Assessment. These are the various things that can affect, and we also looked at the various tests that we can do to access potassium levels in the body, right? So that's it, and bye for now.